Good morning, Professor Blair. So right now I'm going to be doing my physical head-to-toe assessment on my patient here. So we're going to get started now. Good morning. My name is Khadijah Hazel. I'm going to be your nurse today, and I'm going to be performing a physical assessment on you, head to toe. So can I verify your first and last name, please? Can I see your armband?
Okay, my name is Julia Roberts.
Okay, and can I have your date?
7784.
Thank you for verifying your date of birth.
Thank you.
Okay.
Come on. All right. Okay. Excuse me, Professor. Excuse me.
Okay, Professor. So I'm gonna start off by assessing facial symmetry and head size. So right now I'm just assessing her head size at face value. It appears even and normally sized for her body. So at this point I'm going to be palpating her head and assessing for any sores or bruises, lice, things like that. I'm checking through her hair, her scalp, and now I'm palpating for any masses, indentations, and things like that, and there are none. Next, I'm going to be testing her cranial nerve 7. So I'm gonna have you smile for me, and can you frown? And can you puff out your cheeks? And can you open your eyes and close them? Thank you. You can open them again. So that was cranial nerve 7. Everything is in order and working correctly. Next, I am going to palpate her temporal area. But first, I'm going to ask, are you experiencing any pain in this area?
No.
Okay, so I'm going to palpate her temporal area. Everything feels normal. And next, I'm going to palpate her mandibular area. Can you open your mouth for me? I'm checking to see if there's any popping or cracking. Nothing feels abnormal. Everything is smooth and in line. And next, can you open your mouth? I'm checking the resistance against my finger pressure, and she is able to resist the opposing force. Next, I'm going to assess your sinuses. Are you feeling any pain in this area?
Mm-mm.
Okay, so I'm going to palpate her sinuses. Nothing feels swollen or enlarged. Are you having any pain in this area?
Mm-mm.
And I'm palpating. Nothing seems swollen, enlarged, or discolored. And next, I'm going to assess your olfactory nerve, cranial nerve 1. And I'm going to do that by having you, can you obstruct one nostril like this and breathe in and out? Everything is smooth.
Yes.
Can you do the other side for me? Everything is clear, no obstructions. Are you having any pain?
No.
And do you feel that you can smell just fine?
Yes.
So I'm going to have you close your eyes, and I'm going to have you smell something, and you can tell me what it smells like to you.
It smells like lovely flowers.
Okay, that's correct. Her olfactory nerves are working fine. And next, I'm going to assess her eyes for symmetry. They appear symmetrical. Next, I'm going to assess further by using my pen light. And I'm going to do this by fanning the light across her eyes and checking for pupil dilation. Her pupils are round, reactive, and equal, and responsive to the light and accommodation. Her pupils should be between 3 and 5 mm, and they are at about 4. Yes. So next we are going to look at the sclera. Can you look up for me? Her sclera appears nice and shiny and white. No signs of stress or ocular pressure. I'm also going to do I'm also going to assess her cranial nerve 3, 4, and 5, oculomotor, trochlear, and abducens. First, I'm going to do the 6-point assessment. So, Miss Julia Roberts, can you please focus on the pen, keep your head still, and have your eyes follow my motions.
Okay.
I'm gonna go up, to the side, down this way, up this way, across, and across again. And as you can see, her eyes are following just fine. We also already checked the reactivity to light. Now we're gonna check accommodation. So Miss Roberts, can you focus on that point on the wall right there? So right now her pupils are dilated. And as I bring the pen light closer, can you focus your attention on the pen light as I bring it closer to your face? And her pupils are dilating nicely. Nextly, I'm going to assess her ears. So right now, I'm just going to observe for any signs of redness, swelling, discharge, and there are no signs of that on both sides. So now I can palpate for any signs of swelling. Are you experiencing any pain in your ears? Everything feels symmetrical. I'm assessing both sides. Everything feels fine. Nextly, I'm going to palpate her mastoid process behind the ears. Everything feels fine. There's no swelling. There's no masses. There's no tenderness. Nextly, we are going to move on to the vestibulocochlear nerve, cranial nerve 8. And I am going to look inside of your ears. This is my tool to view her tympanic membrane. So I'm gonna pull her pinna up and back. And I'm looking at the tympanic membrane and it appears gray and there are no obstructions as it should be. I'm gonna check the other side. Pinna is going up and back. And everything appears in order there. Next, we're going to look at her lips. And as I can see, her lips appear nice and pink. There's no signs of cyanosis, blue discoloration, or anything like that. Next, we're going to assess the cranial nerve 12. That is the hypoglossal nerve. Can you stick your tongue out for me, please? And I am going to inspect the inside of your mouth. Can you stick your tongue out? I'm going to depress her tongue with my tongue blade. And I'm looking at her uvula. Can you say ah?
Oh.
And the tongue, her uvula is reacting as it should. Can you lift your tongue for me? I'm looking for any masses, ulcers, lesions. In her mouth, there are none. Can you open? I'm looking at her cheeks, her teeth for any cracking, any cavities, any dangerous obstructions, and there are none. Next, we are going to look at her neck. Let me just put my tools away. Okay, so I'm going to be looking at her trachea. Can you lift your head for me? And her trachea appears midline. I'm assessing there's no signs of swelling. There's no visible signs of swelling. Are you having any pain in your neck area?
No.
Okay, so I'm going to palpate her neck. And there's no signs of swelling. And next, I'm going to palpate her carotid arteries one at a time. There's no swelling. There's no evident swelling. So now we're gonna assess cranial nerve 11, her accessory nerves. And can you move your head from the right side to the left side? Keep your body straight. One more time. And nextly, I'm gonna have you shrug your shoulders as I apply pressure. Everything is symmetrical and she's able to shrug her shoulders without any difficulty. And can you lift your head for me? There's no signs of jugular vein distension. Can you turn your head to this side? No signs of jugular vein distension. And I'm palpating the neck. Everything appears fine. And now I'm going to listen with my stethoscope. Okay, can you remove your sweater for me, please? Okay. So first I'm going to palpate your radial arteries. Her pulse is nice and bounding and strong. And I'm going to check the other side. This pulse is also bounding and strong. They're both equal. I would say about 2+. And now I'm going to look at her hands and assess for capillary refill by pressing down on her nail beds. And the refill is about 1 second, which is very good. Next, I am going to palpate her brachial arteries. Again, her brachial arteries, her pulses are nice and bounding, strong. And now I'm going to test her resistance, her muscle resistance. Can you push up against my hands? Good. And everything feels normal.
Yes.
Okay. Can you push against my arms? Good. Okay, you can stand like this. Okay, and can you extend your arms straight out ahead of you and close your eyes? And her arms are steady and even. There is no arm drift. Okay, you can put your arms down and open your eyes. Now I'm going to be chest testing. I'm going to be listening to her heart and lungs. I'm going to start by assessing the area, making sure that there's no swelling, no bruising. Are you experiencing any pain in your chest area?
No.
Okay, so now I'm going to start by placing my stethoscope. Warm it up first a little bit. Placing my stethoscope to the right of her sternum. Can you take 2 deep breaths for me? Okay, and now I'm going to place it at the other side. Okay, you can stop. Okay, her heart appears fine. We're going to move on to the lungs. I'm going to continue assessing her lungs.
The left one.
Can you take a deep breath for me? And I'm going to continue moving down. Right now, I'm assessing her apical pulse.
Oh, you gotta put it there.
And apical heart rate. Thank you. And everything appears normal. Lastly, I'm going to have you turn around so that I can check your lungs from the posterior angle. Turn this way for me. Deep breath. 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 And deep breath. Okay, you can turn around. And now for this part of the assessment, I'm going to be assessing her abdomen, her abdominal area. So first I'm going to look at it. We're going to pretend that her shirt is off. I'm going to look at it and assess for any abnormalities, any swelling, any bruises, any masses. I see none. Next, I'm going to also tape first before palpating. So we're going to start from the lower right quadrant. And I'm listening for bowel sounds. Gonna move up to the upper right quadrant. Now we're gonna move to the upper left quadrant.